Hi, everyone. My name is Brittany Mueller, and I am the simulation coordinator for NDSU Nursing in Bismarck. For those of you who don't really know what that means or entails, as a simulation coordinator, I will talk about that a little bit later, but in short, I teach my nursing students through the use of simulators or mannequins. In addition to teaching nursing students, I am a nurse myself. More specifically, I'm an emergency room nurse. I have been a nurse since 2011, so almost 10 years now, and I was asked by your teacher to put together a little presentation for you just to go over the nursing profession, what that all entails. I'll talk a little bit about my experiences as an emergency room nurse, as well as kind of go over what I do now in simulation. So first off, what exactly does a nurse do? I'm sure you have all seen movies or maybe even know someone who themselves is a nurse. So probably have a little bit of an understanding of what that role entails. However, there's probably a lot more to it than what you've experienced. We use what we call the nursing process in nursing. So first off, we're going to assess our patient. And by that, I just mean we're going to look at them, listen to them. We use the stethoscope, as you saw in the last picture. We feel around, and basically what we're doing is just making sure there isn't anything going wrong with our patient. So do things sound the way they should or feel the way they should? If there is something wrong, we find something concerning in our assessment, then we're going to do an intervention. So maybe that means we're going to give them a medication or offer a different therapy. Most of the time, it means just working with our physician to make a plan for how we're going to fix whatever's wrong. Once we do our intervention and make a plan, we're going to reassess our patient, make sure whatever it is we decided to do is actually working. We do this process over and over and over, hundreds of times throughout the day as we care for our patients. While this may seem, maybe a little monotonous, a little boring, there's so many things that can go wrong and go wrong very quickly with our patients. We are the ones that are with them 24/7. So it is us as nurses who must catch these little things that are going wrong before they become something much more major. So we're at the bedside, we're the ones there, so it's our responsibility to be catching these things. We also do more to care for our patients on a holistic level. So that basically means, while in addition to caring for all their physical needs, we're also there to help them with any social or emotional needs they may have as well. So on that, I'm just going to show you a little video here. Mommy, look, that's my nurse. So as you can see in the video, there's a lot to nursing. Not only was she caring for the needs of that child, but also just those social, emotional needs, wanting that connection. So there's so much more than just passing medications or listening with your stethoscope. So where do nurses work? One of the greatest things about a degree in nursing and becoming a nurse is the vast array of options we have for where we can work. When you think of a nurse, I'm sure most of you think of someone maybe that has helped you, whether it be in the clinical setting or in the hospital. Maybe you had to have surgery or got sick. And yes, this is where the majority of nurses begin working. But even within the hospital setting, there are several different areas of expertise. The pictures you see on this slide are just a few of our students from NDSU and a few of the different areas they've gone into. You could care for adults. Most of the hospital is what we call med surg, and it's just those who are sick, adults who are sick or have had surgery. Those are the medical surgical floors. Or maybe you want to care for those who are really sick in the intensive care unit or the ICU. Maybe you have an interest in caring for children, like you saw in the video. We have the pediatric unit, or babies who are really sick. They're in the NICU, so the neonatal intensive care unit. If babies are your thing, maybe you want to become a labor and delivery nurse and help actually deliver babies. Maybe you want to help the surgeons in the operating room. The list can go on for days. But if you'd rather not work in the hospital, there are other options. Like I said, you could work in the clinic or even a nursing home. Nurses can work for insurance companies or corporations as kind of help give information, or even just be the on-site nurse. If you see yourself advancing your education further, even farther than a bachelor's degree or a four-year college degree, you could become a nurse practitioner, so kind of work in the clinic, being in charge of a clinic, or you could be a nurse anesthetist. They're the ones that put people to sleep when you're going to have surgery, or even teaching, like I do. So there's so many different avenues a degree in nursing can take you. Okay, so while there are tons of advantages of being a nurse, I understand that not everything about the profession is perfect. So if you're looking at nursing, however, you will always be able to get a job. Across the nation right now, we are in an extreme nursing shortage. So no matter where you see yourself living or ending up, there will be a need for you in healthcare with a nursing degree. However, this does then oftentimes lead to a negative, which is that you may be working short, or meaning you don't have as many nurses as you should, which makes you busier and makes it a little stressful. Nurses also, I guess this would be an advantage then, make a pretty decent salary, even right out of college, so right as you graduate. It's going to differ depending on where you live, but I'll just give you a couple examples. In North Dakota, the average nursing salary here is about $66,000 a year, or $32 an hour if you're working hourly. And then Minnesota is actually a little bit higher. The average there is about $80,000 a year, or $38 an hour. So it's a pretty decent salary to start, especially just right out of college. So it's going to be different, the demands of nursing and what you're going to be doing in nursing, depending on where you decide to work. Like I said, the majority are going to be in the hospital. So if you're in the hospital or nursing home, you'll most likely refer to what we call shift work. And what this means is, sorry about that. You would work probably 3 12-hour shifts during the week. So if you think about that, you'll work 36 hours a week, but that's full time. However, a lot of nurses, because of the nursing shortage, will work even more than their 3 scheduled shifts, which, if you're up for that, gives good financial incentive, because then you'll be on overtime. But sometimes then nurses will get burnt out because they're working so much. So something to think about. If you decide to work in the clinic or for a company, you'll probably most likely be on more of the 8-hour shifts, the 8 to 5 type schedule. If you're in the hospital with those rotating shift works, you'll also probably be expected to work weekends. Usually it's every 3rd, and holidays as well. But they do have holiday pay. So earlier I talked about what we do during the day, and most of what I talked about refers to hospital nurses. But with that and what we're doing every day comes a lot of responsibility. So as a nurse, we are always, I shouldn't say always, but most often putting the needs of our patient first. This means we're going to be on our feet all day. Very often, if things are busy and there's stressful things going on, you're not going to get the break or the lunch that you needed. There can be a lot of stress that comes with that and the profession. It can also be very emotionally tolling. We often see lots of sad, difficult situations. So just something to think about as you think about the profession. So I know I probably have you all hooked on nursing. So if you're going to get into nursing, what is it going to take for you to become a nurse? There's lots of different licenses that you could earn that will give you different responsibilities based on what license you have. So a certified nursing assistant or a CNA, they're not a nurse, but they are a huge help in the hospital. So they're going to be responsible or very helpful with a lot of the everyday cares of your patients, bathing, feeding, things like that. A lot of nursing students will actually work as CNAs as they're going to nursing school to help get that experience with communication and just those experiences within the hospital. The next license there is an LPN. They are a nurse, but they only have usually a 1, maybe 2-year degree. While they're still a nurse, because of they only have their degree is only 1 year, they have limited responsibilities. So as you progress from an LPN to a 2-year RN and then even a 4-year RN, within your license, you're able to do more tasks. So we refer to that as the nurse's scope of practice, and it's the different things within their license that they're allowed to do. So we as nurses have to know what tasks and what skills fall within our scope of practice, and those will increase the more education that you have. If you, again, want to go back and further your education even farther, we talked about becoming like a nurse practitioner or an educator. You would need either a master's or a doctoral degree for either of those positions. So what can you do right now? I know that many of the things and the concepts you are learning now, you're thinking to yourself, when will I ever use this? Why is this going to be important? Even in nursing, everything you're learning right now is very important. I know that it seems like very obvious, math, science, seems pretty obvious that those are going to be important, but your reading, your writing, just as important. So I encourage you all to take your classes very seriously. If you have the opportunity, take a few of those college courses in high school, get ahead a little bit. You'd even maybe be able to get your license sooner and start working sooner. This kind of guide here just kind of shows you how we use all of those different educational pieces that you're learning right now. So all very important. The last bullet here that talks about technology is very near and dear to me because that's a big part of my job. I bring a lot of the technology pieces that are being used in healthcare into education so that our students can practice with those. And I'll talk about that again later. So again, I promised I'd talk a little about what I do as an emergency nurse. So this is most likely the type of nursing you've seen in movies and TV shows, right? They're always sprinting their patients into the ER and then the nurses and the doctors all come around. Some of these depictions may be close to what you might see in real life, but there's going to be some that were probably a little off. So in the emergency room, we are nurses. We do what all other nurses do. However, at times, our patients are going to be a little different. They're going to be a little bit more emergent, life-threatening. So we have to work a little faster, work right alongside with our physicians to make sure we're giving the very best care very quickly to try and save lives and make a difference in whether that patient lives or dies. So we see the major traumas, your car accidents, gunshot wounds, anything very major is going to come to us. And that's what people, I think of when they think of emergency room and caring for patients. However, we also see the normal day-to-day illnesses and injuries. So maybe it's somebody who's having a lot of abdominal pain or the child who fell off the monkey bar and broke their arm. All of those patients come to us as well. So it can get very busy and very hectic. Our waiting rooms are usually always full, and we have to do our best to make sure that we're seeing patients by severity. So it doesn't matter who is there first. We see whoever is the most emergent. So I'll just play a little video here for you that kind of gives another idea of emergency nursing.
Emergency is very often chaotic, and we don't have any known injuries that he has. You'll see so many different types of illnesses and disease and traumas or accidents, and so no matter what day you come in, it'll always be something different. You never know what to expect, and that keeps you going. You can always learn something new. I'm an emergency registered nurse, so I've done a specialty degree in emergency nursing. There's the trauma room that I'm working in today. That is where the sickest patients go in. We always suspect the worst possible injury in a trauma. Do we know if he's got neck pain or anything? Emergency physicians really rely on good emergency nurses because you are the first person that sees the patient. You are the one who starts off and asks the patients all these questions. You're the one who goes back and revitals them. I'm just gonna take this out, okay? You do one thing at a time. You don't want to get kind of overwhelmed with what you need to do. People do get very sick very quickly, especially when you don't have a diagnosis. As long as you keep going back to, do they have an airway? Are they breathing? Is their circulation up to adequate standards? If you keep going back to the same rhythm, then you won't miss anything. There's still things that come in that you think like you're
Well, shoot, hold on.
and that you think like your knees are starting to shake and your heart rate goes up, but you just kind of go back to your primary instincts of being a nurse. And her heart rate's coming back up. It's back up at 130. I think the cases that stand out to you more are the people that are younger and more tragic, which makes you realize how important life is or how quick life can get turned around. Being an emergency nurse, you do step back and don't get too involved in any of the cases just because we see so many tragic accidents. But we still go skiing even though we do see spinal cord injuries from skiing crashes because we know that we still have to live our life the way we want to live it. Emergency nursing is something very unique, and I think it's hard to explain unless you're kind of in it. It's a career that you will get gratification from, even in the hectic environment that it is.
Sorry about the pause. But like she said, emergency nursing is a little bit different. It takes this very special person. You can't get very connected to your patients. We don't see them very long. And a lot of negative things happen daily. So you got to kind of learn to brush those off and move on. So I still do emergency nursing today. I do it. I just help out as needed. But my full-time job, like I said, is now in simulation. So what I do is I take those high stress situations, those emergency situations when their patient's deteriorating, starting to get really sick, and I bring those into the classroom and I let our students practice them on the simulators or the mannequins. So our students have a lot of clinical opportunities. They go over to the hospital, they spend hours and hours every semester learning from the nurses and taking care of actual patients. But if there's ever a situation where a patient's starting to deteriorate or it gets emergent, the nurses are going to take over because that's what's best for that patient. However, soon our students are going to graduate and they're going to have that responsibility. So we need to be able to give them that practice experience. So that's what we do in simulation. We use a simulator, so they're very lifelike. You can listen and feel just like you would on a real person. We have the monitors with the beeps and all the sounds. So it really makes a very realistic situation, practice situation for them to have that experience. So basically, a nurse, what do? We like to say we change lives. So we take care of them in so many different aspects. Our care is different based on every single patient, but our main goal every time we take care of a patient is to make a difference in their life, whether we're healing them, saving their life, or just making them feel a little better for that day. So that's what we do. So I thank you all for letting me talk about this profession that I love so much. And I'm going to leave you with one last video that I know is going to get you hooked on nursing.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, It was standard practice to strap down and immobilize patients until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices.
And I will always be grateful to her.